Hello and welcome. You're watching Health and Wellness. I'm Gargi Rawat. The problem of sudden cardiac death is a major concern all over the world, affecting people of different age groups. When it comes to India, the problem has escalated due to the sudden change in lifestyle and food choices. When medical emergencies like cardiac arrest happen around a person, it's important to be prepared. If you are aware and informed, then you take steps to revive a person and save his or her life. Worldwide, millions of people die of sudden cardiac arrest every year, and this is partly due to limited and sometimes ineffective bystander cardiopulmonary resuscitation. Many adults in cardiac arrest can be revived with intact neurological functions if bystanders provide immediate CPR. It is more important to learn about CPR if you have a loved one who has a history of cardiac disease, as research reports that the majority of cardiac arrests occur at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR. Today we have with us eminent cardiologists who will help us understand this. We're joined by Dr. Ashutosh Kumar Vani, Senior Consultant Cardiologist, Clinical Director, Cardiac Electrophysiology Care Hospitals, Dr. Aziz Khan, Interventional Cardiologist, Crescent Hospital and Heart Center, Nagpur, and Dr. Upendra Narayan Singh, Consultant and Interventional Cardiologist, Cardiocare, Patna. Thank you so much, doctors, for joining us on the program. Dr. Vani, first to you. Does your heart change with age? What can one do to help reduce the risk of heart disease?
Yeah, thank you for the initiative. And first of all, change is permanent, as we know, and heart is not immune. So with time, the heart also changes. And there are three dimensions. One's related to the heart rate. When the baby is born, the heart rate is around 140, and over the time, it comes to around 70 to 80 in the adult. And when the person grows older, it again drops to around 50 to 60. So if a patient is in 80s, it may be around 50 to 60 normal for them. Coming to the second part, that the blood vessels that become thicker with age, the plasticity of the vessels reduces. And finally, the vessels, the chamber of the heart, they are also not immune. So the stiffness of the chambers increases, what you call the plasticity of the chambers are reduced. So these are the common changes. Sometimes valve get sclerosed, means the thickness increases, the flow across the valve changes, and calcification also happens. So these are the change which happens with the age, and for that we have to take care. And for preventing, the most important thing what we can do is exercise. So exercise works like an investment. So it's a health investment. If you do on the regular basis in a controlled manner, certainly you are going to push your heart related problems to some other extent. Second is diet and exercise. And a lot of things everybody is doing, but alcohol and smoking, that we should, wherever possible, we should avoid it. And junk food, whatever way, we should not to take in our regular meal. And reducing the salt intake and processed food, that is very, very important, that we should reduce wherever possible. So these are the ways to prevent it and say no to the sedentary life.
All right. Dr. Khan, what is a heart attack? If you could explain for our viewers, and what conditions can cause heart attacks?
See, heart attack is a medical emergency. Coronary disease is the most important cause of heart attack. The heart is supplied by coronary arteries. There are three sets of vessels. We call left side the LAD, circumflex, and right side RCA. These vessels at birth are healthy. Over a period of time, the blood vessels gets blocked or clogged because of various risk factors. And when the block occurs to about 60-70%, then the person starts getting angina or breathlessness on walking. This we call angina. If he takes rest, again the blood flow improves. But sometimes there occurs clot formation or plaque rupture or sudden occlusion of the vessel because of plaque rupture, and then the blood flow is impaired totally, the muscles dead. That will cause heart attack. Now what causes it? It is very important that if you have family history of coronary disease, if you are smoking, for a long time will cause more chances of heart attack. But mind you, if you stop smoking, the chances of regression are also there. Then diabetes and blood pressure, these are important causes. Cholesterol, and what I found nowadays is impaired lifestyle, like lot of stress, corporate world, no sleep, eating junk foods, and lack of sleep. All these causes vessels to get blocked and heart attack.
Right. Dr. Singh, if you could tell us what can happen if a person does not receive rapid treatment after they've undergone a heart attack?
The heart attack is a dire medical emergency. Dr. Khan has already mentioned that the blood supply to the muscle of the heart is get choked. So we need to reperfuse the artery as soon as possible. Otherwise, there will be permanent and irreversible damage of the heart. And a damaged heart can have many complications related to the heart attack, like the patient with a poor LV ejection fraction will have sign and symptom of heart failure, various arrhythmias, sudden cardiac death, and ultimately the quality of life as well as the survival of the patient will be occur. Survival of the patient will be reduced. So that is, we need the most important part of the treatment of heart attack is the rapidity of treatment, and the delay can lead to the several complications and ultimately the survival and the quality of life after the heart attack will happen.
All right, Dr.
Thank you.
Vani, another aspect is, what are the symptoms of a heart attack? How does one know that they're having a heart attack? Because, there are, various issues of pain or gastric issues, nausea, etc. And is it different for a heart attack symptoms for women?
Very right question. So, heart attack, the most common and the most important symptom is chest pain. And chest pain can be always a concern whenever people are having that, yes, they are having heart attack or not, that has to be cross-checked. So the most important complaint, when it will be on the front of the chest and it goes to the arm, and the time you are start walking, it get increase, or any time you are taking stress, it increase. This is we call as a anginal chest pain. So this pain is it comes like a discomfort which increases on activity and which can radiate to the arm. Sometimes it goes to the up to the umbilicus and jaw muscle also. But it is not the only symptom. There is the other symptom like breathlessness, or you start walking, you become so much sweating start happening, or you are feeling that you are sinking. These are also the symptoms of heart attack. There is one important complaint, like if you are getting nausea and vomiting, that may be the initial symptom of heart attack. So which patient, which we have to think that it is due to heart attack, or it is due to the gastric problem, that needs somewhat differentiation. If you are a gastric patient and you are taking the medicines and it is relieving your gastric problem, it can be a gastric problem. But if it is not relieving and you are getting nausea, vomiting, giddiness, sweating, these add-on symptoms are more in favor of heart attack, and it should be addressed. And that's why when you are getting any complaint in the chest which is radiating to the arm, left arm particularly, it may point towards the heart attack. Females are having some different presentations. So they will complain more of the breathlessness. They are having a vague chest tightness going to the back, sometimes the right arm. They may more present with the nausea and vomiting, and sometimes they ignore it also. So one is the ignorance from their side, and sometimes ignorance from the family, and sometimes the complaints are not very, very typical what we get as we talk as a angina. So females are having some different complaints which are more common in the females than the males. Like angina, which is heaviness in the chest going to the arms, is a more common and classical complaint, which is not very common in the females. It happens, but it is not a very commonly present way of presentation for the females.
All right, Dr. Khan, as we've already discussed, chest pain is the most common symptom of heart attack, but chest pain can occur for a variety of other reasons as well. So can chest pain resulting from a heart attack be distinguished from other pain?
It is very important when the patient comes to us with chest pain. Very important to differentiate whether you are dealing with cardiac or non-cardiac pain, because the treatment varies differently for different diseases. At the same time, you cannot miss cardiac pain, saying it gaseous or something like that. This very commonly happens. So what we need to do is a patient who has strong risk factors like smoker, tobacco, or diabetic hypertension is complaining of chest pain. It starts in the chest. radiates to jaw or left arm, as Dr. Ashuko said, with sweating, uneasiness. Probably you are dealing with cardiac pain. We take help of ECG, blood test and echo to complete the diagnosis. However, if the ECG is non-diagnostic, then the things are different. The most important cause is gaseous pain, acid-peptic disease, which many patients have got. It is localized pain, it does not radiate, it does not vary with respiration or movements. Then you have pain with spondylosis, neck pain, you have pain, muscular pain, sarcogenic pain. Lot of pains are there which needs to be differentiated. Two important things in casualty are pulmonary embolism and aortic dissections. They present exactly like cardiac pain. However, ECG may not be diagnostic. Here we have to take help of blood enzymes and sometimes CT angiography to differentiate. But I think it is very important as a doctor not to miss cardiac pain. And mind you, if your pain is continuous, long-standing, prolonged, please don't deny the symptoms. Come to hospital, get ECG and blood test done because it can save the life.
All right, on that note, we'll slip into a short break, but don't go anywhere. We have lots more questions for the doctors. Stay with us. Welcome back to Health and Wellness, Save a Life, and we're talking about heart health. Let's go back to our panel of doctors. And doctors saying a heart attack is a medical emergency. When a heart attack occurs, what is the first step to take and how is a heart attack treated?
Okay. Most important thing is the recognition of sign and symptom of the heart attack. It's very important. If the patient, someone had the chest pain, one should not ignore it as a non-cardiac chest pain or gas problem, as Dr. Khan and Dr. Asutosh has already mentioned. So someone having problem with the chest pain must go for an ECG. ECG is a very basic and cheap tool which can diagnose most of the heart attack along with sign and symptoms. So one should move to a facility where these tests, ECG, echo, and the treatment of a heart attack can be done. So time should not be much wasted at the home. So the patient should move either to a hospital where these facilities are available or call ambulance for that. So if the patient moves in hospital, the most important thing to differentiate it, whether it is a non-cardiac problem or it is a heart attack. If patient is heart attack, the proper treatment should be given right from the aspirin and several other medications, clopidogrel, ticagrelor, newer molecule. And the most important part is the opening of the clogged artery. You know that the basic pathologic factor is that the artery supplying the heart muscle is get choked. For that, the most important and the most valuable treatment is the opening of that artery either by pharmacological means or by doing a primary angioplasty for that. So as soon as the artery is opened, the blood supply of of heart muscle is established and outcome for of these patients are better. So that is the best part, along with the other cardiac supporting medications are given. So the heart attack treatment can be done only in hospital only and very few scope at the home. So time should not be wasted at home. That is my message. Thank you.
All right. Dr. Vani, what is worse, a cardiac arrest or a heart attack? And can a heart attack cause cardiac arrest?
Of course, cardiac arrest is something we call as a very few minutes are left between the intervention, means life and death. So it is only 3 to 4 minutes left between the cardiac arrest happening and patient dying. Cardiac arrest is due to the electrical problem of the heart, what we call as the arrhythmia. There are some lethal heart rhythm abnormalities we call as a ventricular tachycardia or ventricular fibrillation. And when it happens, it standstills the heart stop pumping and circulation is not reaching to any part of the body. And that time, the role of CPR or the bystander CPR is very, very important. If somebody can do it and if the ability of defibrillator is there, it makes the difference. So cardiac arrest is due to the electrical problem, while the heart attack what our previous speaker was saying, it is due to the choking of the vessels, means the blood vessels which is supplying the heart, it is getting blocked, and you are having that time some symptom of chest pain or breathlessness or giddiness, you can reach to the hospital. But if a heart attack is happening and on top the patient develop arrhythmia, he arrests. He arrests at that particular time when cardiac arrest happens, and that time the patient die at home also or during the transportation. So heart attack, around 25% of patient who does not reach to the hospital, the reason it cardiac arrest also happened during the transportation or the heart, and that time the CPR or defibrillator facility either in the mobile unit means ambulances or in the society makes a difference in the saving the patient's life. So in a patient of heart attack, cardiac arrest can happen.
All right. Dr. Khan, now let's talk about CPR. What is hands-only CPR and what rule should a rescuer keep in mind when giving compressions?
See, if you are at home or at some public place and some of your relatives or some passerby collapses, it is probably because of a cardiac arrest. And in that case, you can only save the person. And therefore, I made it a point that everybody, liftman, surrounding people should know what is the right CPR, high quality CPR. Now, hands-on CPR has got two parts. One is respiratory efforts and second is chest compression. Now, here what I do is, first is don't get panic. Very important, don't get panic. Secondly, call for help like ambulance, paramedicals or somebody who can come and rescue you. Then afterwards, what you have to do is clean the space and within 10 seconds, look for carotids. Carotids are situated just next to your trachea. So carotid, look for carotid, look for respiration and look for breathing. If you don't get that, start compressing the chest. You have to hold your both fists like this and start giving compression. It should be 100 to 120 times per minute. And the depth compression should be about 5 centimeters. And then after 30 beats, you should again see for respiration. And this you should continue till the help comes or some paramedical comes or other person comes to help you. But you should never leave patient in between, because if you do proper high quality CPR in an acute cardiac arrest, you can revive the patient. And that is very important. So hands only CPR, it is very important. Push in correctly for about 100-120 minutes times and 5 centimeter depth.
All right.
And look for respiration.
So clearly a lot to be kept in mind when performing CPR. Dr. Singh, if you could tell us, can you damage someone's heart if you're performing CPR while it's still beating?
Dr. Khan has already mentioned that is a very medical emergency condition. There are only few minutes between life and death. So any degree of CPR, even by the bystander or lay person, can help in resuscitating the patient and bringing the life back. And there is myth that it can damage. Actually, there is always a benefit in doing CPR rather than damaging the heart. So any amount of CPR even done by the layman bystander is helpful in the survival of the patient.
Right. Dr. Vani, is a person at greater risk for a second heart attack if he or she has already had one, and then can this be prevented, a second heart attack?
One heart attack invites the second attack, and means a person who is already having one blocked vessel can have the same vessel can get reblocked or the other vessel can get blocked. It is the disease which is existing in the person. So heart attack invites heart attack, what we call as, and there is a lifestyle modification, medicines as well as physical and exercises. These are must for the patient who has having the heart attack. So in no condition we should omit that we can develop heart attack after stenting. We have to accept that yes, stenting has been done or treatment has been done, but at the later stage again we can develop heart attack. So regular medicines, exercise, dietary restriction, and whatever the preventive aspect we discussed earlier, it should be the norm for the patient throughout the life.
Right. Dr. Khan, how long will a person need to rest after a heart attack? When does a person, start doing exercise after recovering from a heart attack, and which exercises are safe?
every patient asks the same question. With the modern therapy like good medicines, angioplasty and bypass surgery, our patient can resume work early. But you have to give respect to the muscles of the heart. They are damaged because of heart attack. So 4 to 6 weeks is a recovery time normally. So after 2 weeks, patient should start walking. Walking or swimming, they are the best exercise, 15 to 20 minutes. But before that, you need proper assessment of his heart function, LV function, etc. Your cardiologist can only tell which exercises are better. But you should avoid going to gym immediately after exercise, after heart attack. You can do swimming, yoga, and walking like that be done, and should be but under controlled environment. Then we have cardiac rehab centers nowadays where they take care of exercise, diet, weight, etc. So better is to consult cardiac rehab centers to have proper exercise program. You should not overexert yourself. You should not push yourself doing lot of weight training, etc. immediately after heart attack.
All right. Well, thank you so much, doctors, for taking out your time and answering all those questions to create awareness about this very, very important thing, heart health, as well as how bystanders can intervene and save a life. Thank you so much. And thank you all for watching at home. Goodbye.